we welcome you back to On the Beat. Isaac hosting today, and in the studio today I have with me Dr. Francisco Sierra from Monroe Regional Hospital's Cardiology Clinic, talking everything cardiovascular health and how to receive treatment. Dr. Sierra, we sure appreciate you taking some time with us today, and your experience really is what draws people to Monroe County and your clinic.
Well, thank you. Thank you very much. I'm glad to be here.
All right, so as a cardiologist, what services specifically are you trying to pinpoint and treat?
Well, the hospital, I think, is doing a tremendous effort in trying to expand some of the services they provide. They do have a very extensive network of nurse practitioners for primary care, but there's always a need, especially in an area, of trying to pinpoint some of that attention to cardiology. So I would provide services trying to identify some of the cardiac problems, diagnose, and hopefully treat and refer the ones that need further attention, more specialized attention.
All right, in terms of the population you serve, we're looking really at age groups. You mentioned to me earlier that really targeting some of the more susceptible population, but really cardiovascular health could even impact younger folks as well. But in particular, you focus on the elderly population.
Yes, we see everyone from age 18 and over. But what we're trying to make it a little bit easier is for the elderly population or the population that is disabled, that has difficult access to reach other places, or the patients that have difficulty transportation or their family has difficult transportation, make it more accessible. It's a very accessible area, no stairs, and we're trying to make it easier for those populations.
Yeah, that's good. And you mentioned, identify and sort of get that initial treatment underway, because, sometimes people may have to travel multiple hours to get that same treatment, and then they have to still get further treatment down the line. And that's where your clinic really steps in and kind of takes a lot of that hassle out of the equation.
That's correct.
All right, number 3, diseases that you cover in particular, any specifics that you want to mention?
Well, from the cardiac standpoint, we usually see 4 different kind of symptoms. Chest pain, of course, if it's related to the heart, shortness of breath. The patient comes with palpitations and heart irregularities, and even blackouts or syncope, and obviously heart failure and swelling on the lower extremities or difficulty breathing.
All right, so say someone may have experienced this recently and they want to get in touch with you. Your schedule weekly is on Thursday, correct?
It's also Thursday, and that specific patient that you mentioned, yes, when you had asked about services provided, we do have services. We have the EKG, we have the ultrasound, we can take pictures of the heart and give a better diagnosis.
All right, and then finally, again, the area that you really want to focus on is not necessarily Monroe County specifically, but just anybody within a half-hour driving distance.
Yes, we want to make it more accessible. We, of course, we're going to deal with Monroe County, but
sure.
Lowndes County, Hamilton, Nettleton, all those areas that are accessible to them, we can provide services.
All right, Dr. Sierra, really appreciate some of your time and efforts today. And for more information, you can head to the website or dial the number there on your screen. We'll be back after this.